Hi, I'm Dr. Tressler, and today we're going to talk about some of the rehab we do at home and to help restore the curve of the neck. Now, it's all about reaching our fullest potential in health, reaching our fullest potential with our spine and getting the maximum amount of correction. So it's not about just feeling good, it's about being well and having the proper nerve flow, the proper spinal cord flow, so you have your optimal health. So when we look at the cervical spine, the neck area, this would be the bottom of the skull, and this would be looking this way, face forward. So my eyes are here. The curve in my neck should be shaped like a banana, just like this, like a bend. But what happens through birth trauma, when they pull babies out, through falls, through accidents, through whiplash, through going down on a slide and bouncing on the ground, through falling off swings, wrecking our bikes, sports injuries, the neck area can get straightened out. Now this is devastating to our health because it stretches the spinal cord, compresses the spinal cord, which you do not feel. Spinal cord does not have feeling. And then you compress or pinch all the nerves. Now these nerves supply life to your body. So if you shut down on the life, what do you get? You end up getting death to that tissue. If the nerve here goes to my arm, I get tingling in my arms or hands. I get numbness. So if I take the pressure off the nerve, then the tingling goes away. The healing is restored. But if these nerves go to my heart, then my heart starts to break down. If they go to my lungs start to break down. Wherever they're extended to, whatever organ or tissue or muscle it's extended to, if you squeeze the life, you get death to that tissue. And over time, whether it's months, years, then we get death and destruction to that tissue area, and then we get symptoms. So when we see this type of neck on an x-ray, our job is to help restore the curve. That's done with both chiropractic adjustments, very specific and scientific principled adjustments, and rehab not only in our office, but things we do at home. And one of the things we do is with a neck orthotic. It's a neck block where you just lay over. It's very easy, but very effective. So what we do is, with a neck like this, they'll lay over it, and what it does is it stretches the neck area back into a curved position. And over about 10 or 15 minutes, these ligaments on the front of the neck become stretched like a rubber band. When they become stretched like a rubber band, they become loose, and they allow the neck to go back into its normal position. When this is held in its normal position, then it gets strong and healthy and stays that way. When it stays that way, then the nerves open up, the pressure off the discs that separate the bone open up, and you actually get some disc height regeneration, and the spinal cord pressure is alleviated, so then you get normal spinal cord flow. What this results in is higher amount of optimal health, optimal healing. And in the beginning, sometimes it's tough. It's sore on the neck because you're stretching ligaments and muscles that haven't been stretched in this way. But over time, as that opens up and stays that way, now you have permanent healing. You have higher levels of healing. That's what it's about. It's not about just feeling good. It's about correction of the neck. And there's two ways to use this. You can see how this is slightly slanted, and this is straight up and down. Well, you start with the slightly slanted, so your head can rest on there and it's not so severe. It's a little bit easier to do. And once you get up to about 10 or 15 minutes, then you turn the block around. So then now your head can hang freely over the bar and get a deeper stretch. And I'm going to show you this on my body, how it's done. I'll just show you this way. So you just put this right at the base of the shoulders, in the middle part of the neck, and stretch like that. And what that does is it pulls the C curve, the banana-shaped curve into the neck. And I have to tell you, it's a little stressful because this is hard. The reason it's hard is it allows it to stretch and bend. That's all it is. And then you just lay there for 10, 15 minutes, allowing the neck muscles and joints to open up and stretch. And over time, it gets easier. Now what you can do in the beginning stages is lay a real small cloth down, kind of like a t-shirt or a dish towel, over the plastic part to make it a little bit more tolerable so it's not as hard. And then if you need it like that, that's fine. The object is getting enough stretch over the fulcrum to bend the neck. If it's too soft or too wide, the neck won't curve over it. It needs to be bent over it. And that's an easy thing. It's similar to when the dentist started giving toothbrushes out many years ago and tell you, take your toothbrush and brush 3 times a day. Teeth hygiene. If you don't brush, plaque builds up, food builds up, and your teeth decay. Spinal hygiene. We need the curve. It's the most important aspect of our health. We need to do spinal hygiene. We need to work on our spine every day, work on our posture, work on the curves in our spine, opening that up to allow for optimal healing. That's how that's done. Never ever miss this. These home rehab exercises are designed to support healing and continue moving you towards better health and stop the breakdown of what's happening in society. When you sit at the computer and your head's forward, when you sit and you read books, everything goes against that curve. We need these things to help us day to day, year to year.